Thank you for purchasing the Oral Screen Test Kit by Avitar. You've joined thousands of other businesses and institutions that are taking a unique approach to the delicate issue of drug testing. This innovative product is the world's first rapid test for drugs of abuse using oral fluid. So what do we mean by oral fluid? Oral fluid is a combination of saliva and other fluids present in the oral cavity. The oral screen system utilizes this fluid to analyze the concentration of drugs traveling in the circulatory system, as well as any residual drug present in the oral cavity. The benefits of oral screen are numerous. For example, it's very easy to use. Anyone can be trained to administer and interpret the test. The test can be administered anywhere, at any time. There's no need for special sample collection facilities. Unlike urine tests, there's no gender-specific observation required. Men can test women, and women can test men. Currently, there is no method for adulterating oral fluid, unlike urine. A cost comparison to urine testing equals a net savings to you. And test results are available in 15 minutes. The oral screen system consists of two components: the patented Oral Screen oral fluid collector and the Oral Screen test device. We'll now take you through the testing process step by step. Remember that Oral Screen is only valid for use with oral fluid. The Oral Screen system should be stored and used at room temperature. It's important that the test device remains sealed in the package until you're ready to use it. Start by removing the test device from the foil pack and placing it on a flat surface. Once removed from the package, verify that there are green lines next to each imprinted drug or control mark. Do not use the device if these lines are not present. Ensure that the person being tested has had nothing in their mouth for at least 5 minutes prior to sample collection. Next, remove the collector from the packaging, then slide the plastic hood back, exposing the AccuSorb foam. Encourage the subject to pucker their mouth to accumulate oral fluid prior to inserting the collector. Now ask the subject to place the foam collector into their mouth and move it around. The subject may gently press against the foam with their tongue to encourage absorption of the oral fluid. Keep in mind that the subject should not chew or suck on the foam collector. The collector should remain in the subject's mouth for 2 minutes to allow the oral fluid to enter the foam. Next, remove the collector and hold it horizontally to the table. Note, the foam will swell to about 150% of the original size as oral fluid is collected, indicating a proper amount of fluid is available. If the collector does not appear to have enough oral fluid, it can be reintroduced into the mouth or a new collector can be used. Additional collectors are available from your oral screen supplier. Continue holding the collector slightly upright with one hand and use the opposite hand to gently slide the hood forward until resistance is met. The hood should now completely cover the foam. Squeeze the hood together using your index finger and thumb until the foam just begins to release the oral fluid. And slide your fingers towards the front of the hood until drops begin to form at the tip. Carefully place 4 drops of oral fluid, one at a time, into the test device sample well. Allow 10 seconds between each drop. Do not allow the collector to touch the bottom of the sample well or the test strip. Note, it is very important not to overfill the well, as this may affect the performance of the test. Properly dispose of the collector after the 4 drops have been placed in the sample well. At this point, verify that the test device is working properly by observing a pink color change on the test strip. This pinkish tint may be present in the background for the duration of the test. You should notice the green lines beginning to wash away. Allow the test to run for 15 minutes after applying the sample. It's now time to interpret the results. You will notice a C on the test device. This represents the control line. The test is only valid if a red line appears at the control line position. After you've verified a red line at the control position, you can now review the results. Each drug category has a corresponding line. THC is the abbreviation for marijuana and metabolites. COC is the abbreviation for cocaine and metabolites. OPI is the abbreviation for opiates and metabolites. Presence of a red line next to each drug indicates a negative result for that drug. The absence of a red-colored line next to a drug indicates a positive result. Please note that multiple positive results are possible. It's important to keep in mind that the color and definition of the line may vary slightly. Oral screen results are qualitative, meaning they only produce positive or negative results. Variation in line intensity does not indicate a quantitative value for either positive or negative results. Please note these examples as your results may look similar. This indicates positive for cocaine. This positive for opiates. This positive for THC. And this sample shows no positives. In rare cases, it is possible to test a sample with a high concentration of drug in the sample. Oral screen may actually appear with a brilliant white line, which indicates a high concentration of drug. This is still a positive result. Remember that the absence of a red-colored line indicates a positive result. Oral screen is a screening test for drugs of abuse. A positive oral screen result indicates the presence of a general class of drugs. It is recommended that a confirmation test be performed on any positive oral screen result to identify the presence and quantity of specific drug compounds and their metabolites. A confirmation test via oral fluid is available from Avitar. The method is a lab-based test using GCMS, a standard test method used in the industry. For confirmation, acquire an oral fluid confirmation kit from your oral screen supplier. Follow the simple directions included in the Oral Confirm Kit. This concludes the training program for Oral Screen. We're confident that you're ready to properly use the Oral Screen products. If you do have any questions, please call Avitar's technical service. Thank you for purchasing Oral Screen, the world's first rapid drug test using oral fluid. For other options in drug testing without urine from Avitar, contact your oral screen supplier or Avitar's customer service, or visit our website, www.avitarinc.com. Inquire about Hair Screen, the test for drug use during the past 90 days that starts with a few strands of hair. Avitar, offering you drug testing with dignity.